Hi everyone, I hope you had a great weekend. Welcome to the first lecture of Epidemiology for Clinical and Translational Research. I will be posting video lectures throughout the course that will briefly go over your reading assignments to highlight what I think are some of the main points to focus on from each chapter. I'm going to try and keep the videos somewhat brief because I want you to focus on the discussion boards in your assignments. So just to get started, Chapter 1 talks about what epidemiology is. So it can be defined as the study of how disease is distributed in populations and the factors that influence or determine the distribution. So people who study epidemiology are epidemiologists. So what this means for me in my real-life day-to-day work is that I use data to understand how HIV is distributed in our population, specifically in the state of Maryland. So that means I want to know who's infected, who's becoming newly infected, kind of characterizing these people and what the disease looks like and why. Another example would be that everyone is probably familiar with is the Ebola outbreak that occurred, I guess it started over a year ago. So our state head epidemiologist at Maryland was on call. So whenever someone from the airport would come in who was flying in from out of the country, presented with symptoms that looked like Ebola, he was on call to see if they matched up with what we thought Ebola truly looked like, and kind of report that into a registry so we could understand if this was part of the epidemic that we were seeing. So in your book, they show you two graphs. One shows death rates per 100,000 people in 1900 and then again in 2009. What this comparison is really showing you is what epidemiology is all about. You're comparing how these patterns of disease and death have changed over time. So we can see that there are a lot of reasons for this shift from more infectious diseases to chronic diseases. I think some of these reasons are discussed in your book, but it's really important to recognize that epidemiology is understanding why we see this shift. So it could be, for example, how our standards of hygiene have really improved since, and that often decreases rates of infectious disease. But on the other hand, increased rates of heart disease and stroke can often be attributed to poor diet, nutrition, some things that we really think about in the 2000s these days, especially in the United States. So moving into Chapter 2, one of the things that I think is very important they talk about is modes of transmission when it comes to diseases and illnesses. Some diseases transmit through what we call a vector. So an example of this is malaria. Malaria is not transmitted from human to human. It really is transmitted from human to mosquito to human. So something that transmits human to human would be something more like the flu or even the common cold. A couple other definitions that I think are very important from this chapter are endemic, epidemic, and pandemic. So an endemic disease is something used to describe a disease or illness that is very common in that population or area. So an example would be malaria in certain parts of Africa or South America. This means that we expect to see malaria there. It's been going on for a long time. It's not a surprise to see rates of malaria kind of remain high in those parts of the world. You would not expect to see malaria in Boston, so you would never describe malaria as being endemic to Boston or really anywhere in the United States. An epidemic is a disease or illness that you see in a population where you would not expect to see it. So an epidemic doesn't have to be a huge, widespread thing. Again, it's just finding diseases in numbers that you wouldn't expect. The flu is often considered an epidemic in a number of places. After the Haiti earthquake, there was also a very long-lasting increase in the number of cholera cases, which we would also consider to be an epidemic of cholera. Finally, a pandemic is an epidemic that is spread throughout the world. The most famous pandemic would be the bubonic plague or the Black Plague, which occurred in Europe, and I think it was the 1300s. So a lot of people would also consider that the recent Ebola epidemic would have become pandemic. We saw cases in numbers that we did not expect, and it started in parts of Africa, in Liberia, and then it was kind of spreading throughout the rest of the world. So one thing to note that your book does go into is that an outbreak of a disease is not the same thing as an epidemic. An outbreak is just thought to be a small, kind of brief blip in numbers, whereas an epidemic is more long-lasting. So make sure to just go over that distinction in your book. Finally, the last thing I want to touch on is in Chapter 19, Public Health and Public Policy, and really how they go hand in hand together. So epidemiology is a field where our main purpose is to try and limit the health risks in our population. But that does not bring up the question of how to keep people safe. But we need to make sure that we're providing people with information to make their own choices while still thinking about how we can use health policy to really guide these decisions. So my examples are often HIV related. I'll try and use others. But in HIV work, we really do think about public policy. So while we do have an HIV epidemic in this country, we really see these increases in major cities like Baltimore, Washington, D.C., Miami, and New York City. So some policy that becomes very controversial related to HIV is meant to help keep people safe, but not everyone agrees with this. So we use a lot of epi data to try and inform this work. So one example is needle exchange programs, which is providing clean needles to people in cities where there are rates of high injection drug use, which is related to transmission of HIV. So until recently, federal funding could not be used to support needle exchange programs. That has recently changed. So these are just a couple examples that I hope provided some insight into an introduction to EPI. I hope you enjoyed these 3 chapters. It's really nice to start to understand what epidemiology is and how it can relate to all of your work. Please let me know if you have any questions at all from the readings or the discussion board questions for the week, and I'm very excited to see what you have to show in the discussion boards and what EPI and the news examples that you come up with.